I was gaining weight like crazy, and I would go to my doctors for help, and all they ever said was to work out harder, eat better. They said that I had fat genes. They said I would always have a weight problem. They disregarded all of my other symptoms and said I was crazy. And this went on for about 8 years, and I finally did my own research and discovered I had a brain tumor, and that was causing all of my weight gain. And a year ago, I had brain surgery. I had the tumor removed. Since then, I've lost 40 pounds.
That is unbelievable. And that is devastating. And these types of stories make me furious. I am a physician. I'm a family physician. I am a doctor. And we doctors, yes, have been known at times to fat shame, to not listen to the patient, to not pay attention, to let our own biases get in the way of how we treat patients. And that is never okay. You know, the story of this young woman is an extreme one, but it's a perfect example of what can and has happened to many patients. First thing I want to know is, has this ever happened to you? Have you ever been fat shamed? Meaning sort of shamed for your weight, number one, but the other part of it is sort of disregarded. Disregarded, you're having your symptoms disregarded, your complaints disregarded, because people have looked at your size and have put that first and really have blamed everything on that. You know, we see this sometimes with things like, knee pain or orthopedic issues. Oh, well, if you only lose a few pounds, if you got down to this weight, your knee pain wouldn't be a problem. Now, let me be very clear. Knee pain, a lot of the time, is contributed to by excess weight. That is a fact, okay? And losing weight often helps a lot of different types of knee pain and underlying knee pathology. So let's just be very clear about that. However, not working up knee pain, for example, and this is actually somebody told me this years ago, that they had knee pain or leg pain, maybe it was arm pain, I don't know. And the doctor kept blaming it on their weight. And it turns out they had a very serious underlying medical condition, because the doctor never did x-rays, never sent them to an orthopedist, never did anything about the pain they were complaining about, just said, oh, if you lose weight, it'll get better. Turns out they had a very serious condition that was missed. And this is what we worry about. This is what the tragedy is. Twofold. One is the fat shaming, okay? We know that weight is not just a matter of willpower. It's not just, oh, if only they tried harder, or, oh, you're not doing enough. That's how we used to think in the past. By the way, and I should say, one of the reasons why it's very important that we have a lot of the newer medications that we have for weight loss and other things is because we now know that obesity, weight is multifactorial. We know that someone's weight is not just dependent on what they do and what they don't do. It's not just dependent on willpower. It is dependent on your genes, your environment, your habits, but so many other things that sometimes you do and sometimes you don't have control over. So fat shaming someone is almost like, in my opinion, shaming someone who's got some condition that they can't help, cancer or something like that. Maybe an extreme example, but you get my point. We don't necessarily blame cancer patients for having cancer, right? And so how we look at weight and obesity shouldn't always be first going to blame that person, saying you're not doing anything. Now, yes, there are situations where that's the case, of course, but we know that weight is a lot more than that. So by the way, if you've been feeling that misunderstood about your weight, let me tell you, times are changing. And we now know that weight is not just about willpower. So please rest in that power and that comfort, okay? Still, obviously, we all need to be doing the best we can with trying to maintain a healthy weight, etc. But for some people, that's probably not ever going to be enough. And we know that. The second thing, though, is just like in the video that I showed you, is the idea of using weight to dismiss other symptoms. And that's the second thing. And that is also what is a problem, if not just as much, if not even more of a problem as the fat shaming. When we start saying, oh, your abdominal pain is probably because you have too much fat around your belly, or your knee pain is because you got too much weight on your knees. I mean, certainly those things may be true, but without evaluating it, then it becomes irresponsible. Don't ever let a doctor dismiss your symptoms based solely on your weight. There always needs to be a workup. There always needs to be an investigation, an evaluation, a proper physical exam, proper questioning. And yes, maybe the answer is that it's your weight. Okay, fine. But let us say that after we have done all the right things to look into it. So listen to your body. Just like the woman that we saw in the video, she listened to her body, and thank goodness she did. Always listen to your body. And if you feel like someone or your doctor or healthcare provider is not listening to you, then find another one. And by the way, this video is from an excerpt from a Dr. Oz segment I did years ago. And I feel like it's more important than ever. I'm going to link the full episode of that video to this video. If you're watching this video on Facebook, just DM me if you would like it. On YouTube, it'll be in the description, and I'll also link it in the cards and the end screens as well, so you can see other examples of fat shaming and how that has hurt people's health. It is never okay. And doctors and healthcare providers, we need to do better. There is weight bias in the world and also in medicine, and that is not okay. So we always need to be striving to do better. And patients, just know that you have a right to get the medical care that you deserve. And you do not deserve someone dismissing your symptoms without a full and appropriate evaluation. You deserve better, and you deserve more. So always feel free to go and find that more, because you deserve it. I want to know what your stories are. Write in the comments. Have you ever been fat shamed by a healthcare provider? Let's talk about that specifically, where a doctor has sort of kind of, thrown around your weight, kind of blamed you, kind of demeaned you or belittled you because of your weight. Has it ever happened? Write in the comments. And then also I want to know, has it ever happened where you feel that your medical condition has been written off because of your weight? That a proper evaluation was not done because of your weight? Write that in the comments. I ask you all to write in the comments because what you write often helps other people tremendously. Guys, these are examples that I hate that I have so many examples of, but unfortunately I do, and so many of us do. Healthcare providers, let's continue to work better and to do better, okay? And honestly, the world has a weight bias problem, and that is not okay either. Guys, I'm Dr. Jen. It's great to see you. Thank you for watching and listening. I hope this was helpful. On Facebook, please like and follow my page. I do daily videos there. On YouTube, please subscribe to my channel if you haven't. Click the little bell for updates. Also, you can join my membership groups. I have membership groups on Facebook and YouTube. You can have access to exclusive content on both of those, exclusive lives. Also, I have a free health newsletter that goes out weekly. Please go to www.drjencaudle.com. You can sign up for that free health newsletter. Shoot, while you're there, please sign other people up for it too. You'll get it in your inbox. Also, you'll have a chance to communicate with me by email and stuff if you so choose. And then also, as usual, I'm on all the other social media sites, Instagram and the TikToker and the YouTube. Well, I already said YouTube, but Threads, Instagram, WhatsApp, TikTok, etc. I'm even on LinkedIn. Okay, I mean, why not? I'm at Dr. Jen Caudle. Guys, you guys are amazing. Never forget how amazing you are and that you deserve the best. Love y'all.